Our next two speakers are treasured colleagues and members of our Turo oncology team. Terri Bateman is a dedicated oncology nurse with nearly 30 years of experience supporting patients and families throughout their cancer journeys. A graduate of Charity Delgado Nursing School, Terri has spent the last 13 years serving the Cancer Center at Turo LCMC, where she plays an integral role in patient care, program development, and survivorship support. For the last 3 years, Terri has served as a survivorship coordinator, leading efforts to expand, strengthen the hospital's survivorship program. Terri's fun fact is she brings joy, rhythm, and spirit to her work and community as a proud member of the LCMC marching crew, the Heartbeats. Rachael DiMario McNamara is a board-certified oncology physical therapist and supervisor of Turo Infirmary's Cancer Rehab Clinic. Originally from Baton Rouge, she obtained her bachelor's degree in biological sciences from LSU. Her career in oncology began while attending graduate school at LSU in Shreveport, where she was selected among her class to complete a clinical rotation at MD Anderson. Rachael has worked exclusively in the oncology setting for the past 6 years and recently became one of 2 board-certified clinical oncology specialists in the state in 2025. She currently leads a team of dedicated physical, occupational, and speech therapists at Tulane's Cancer Rehab. In her spare time, Rachael enjoys spending time with her husband, Ryan, and her 2 cats. She may even be spotted dancing in the streets with her ABBA-themed dance crew, Voulez Crew. So you may notice that from these bios that dancing is very important to people who work at Turo. And if you're interested in coming to work with us, we can set up an audition.
Good morning. Please bear with my voice. I've been attacked by the pollen today, so. All right, so today we're going to talk a little bit about survivorship, how we integrate supportive services derived from the distress thermometer, and how this can help survivors continue to do well throughout their life. All right, cancer survivorship has become an essential component of modern oncology due to increasing survival rates and shifts in treatment paradigms that allow more individuals to live longer after diagnosis. Survivors frequently contend with a multitude of long-term and late effects spanning physical, emotional, social, and financial domains. If left untreated, distress can worsen clinical outcomes, hinder adherence to follow-up care, and significantly diminish quality of life. Research demonstrates that cancer-related distress is highly prevalent, yet under-recognized, with many survivors reporting unmet psychosocial and supportive care needs. This highlights the necessity for structured, proactive survivorship care models that incorporate distress monitoring, timely referrals, and coordinated multidisciplinary support. Survivorship care also emphasizes continuity across cancer course, recognizing that patients' needs evolve from active treatment into long-term follow-up. This involves addressing fatigue, cognitive challenges, emotional distress, nutritional concerns, role changes, financial toxicity, and social isolation. Healthcare systems that implement comprehensive care frameworks, such as integrating navigation, counseling, rehabilitation, lifestyle interventions, and preventative health programs, promote resilience and empower survivors in their recovery. The survivorship journey further extends into enhancing well-being, reinforcing post-treatment identity, and supporting reintegration into daily life, work, and relationships. By acknowledging survivorship as a distinct phase requiring dedicated resources and infrastructure, oncology teams can deliver personalized, holistic care that reflects best practices and current evidence. Collectively, these efforts contribute to improved clinical outcomes, reduce psychosocial burdens, and the overarching goal of helping individuals not merely survive cancer, but truly live well beyond it. All right, what is distress? Distress is recognized as a multifactorial experience encompassing emotional, physical, social, spiritual, and practical concerns. that can significantly influence a patient's cancer experience. Despite its prevalence, distress is frequently underscreened in oncology settings, partly due because clinicians' limited familiarity with validated tools and challenges integrating screening processes into clinical workflows. Effective distress management begins with the use of a validated patient-friendly screening instrument capable of capturing the broader perspective of distress rather than isolated symptoms such as depression or anxiety. These tools should be ideally brief, inexpensive, and easily incorporated into the EMR to facilitate routine use. The one we're going to concentrate today on is the NCCN Distress Thermometer. We'll call it DT for short. It has emerged as one of the most widely adopted tools due to its simplicity, visual analog format, and accompanying problem checklist. When a cancer program is implementing the use of the DT in survivorship, it is important to have the workflow aligned with organizational capabilities. Barriers such as inconsistent screening practices, lack of follow-through on referrals, or insufficient linkage to supportive services can reduce screening effectiveness. Nonetheless, consistent use of validated tools remains central to evidence-based survivorship care, improving early detection of distress, guiding individual intervention plans, and ensuring that supportive care resources are deployed appropriately. Ultimately, validated screening tools form the backbone of proactive, holistic survivorship programs that strive to improve patient well-being. Okay, here's the NCCN Distress Thermometer. We at our facility like to administer this at the initial visit. We'll also administer it as needed if in infusion they feel that the patient is having distress. We'll find out what's causing it. We'll also administer this in radiation, and then I'll administer it in my meeting with them for survivorship. And on the left-hand side are the concerns that a survivor may have, and from that is how we make our referrals. All right, so how is this NCCN Distress Thermometer, how is it structured? So it's a streamlined evidence-based tool designed to assess cancer-related distress through a simple 0 through 10 scale accompanied by a comprehensive problem checklist. It is recommended for routine use by leading organizations including NCCN, ASCO, and the American College of Surgeons Commission on Cancer. The DT captures distress across multiple domains: emotional, physical, family, practical, spiritual, allowing clinicians to identify underlying issues driving patients' distress scores. In many real-world applications, a score of 4 or higher serves as a threshold prompting clinical interventions such as referral to counseling, nutrition support, palliative care, rehabilitation, or financial guidance. The DT's usability across different cancer types and care stages from diagnosis through survivorship has supported its widespread adoption. Tailoring its use to the specific resources and staffing of each institution is therefore essential for optimizing its impact. When effectively integrated into clinical workflows, the NCCN Distress Thermometer enables timely psychosocial interventions, improves patient coping, enhances emotional well-being, and ensures survivors receive comprehensive patient-centered care that supports quality of life. Referral pathways linked to the NCCN Distress Thermometer are integral to ensuring that distress screening results translate into actionable patient-centered care. Many institutions commonly use tiered models in which distress scores, particularly those at or above 4, activate specific intervention pathways. These pathways may include referrals to behavioral health, providers for emotional concerns, social workers or financial navigators for practical challenges, dietitians for treatment-related nutritional issues, navigation service for care coordination needs, or rehabilitation for physical limitations. Real-world evidence highlights that these pathways vary widely, reflecting differences in clinical settings, available services, and staffing structures. Some organizations employ nursing staff or medical assistants to administer screenings and initiate referrals, while others integrate these tasks into electronic health systems that automatically flag concerning scores. And despite this variability, the fundamental goal remains consistent. You have to connect survivors promptly to tailored resources that can alleviate distress and enhance resilience. At our facility, our navigator will receive the distress thermometers at the initial visit, and she'll triage those. Anything above 4, she will call the patient and see if they would like that referral. And the other one, she will still call to let them know about the supportive services that we offer throughout their cancer journey. Integrated survivorship support models aim to address the wide spectrum of challenges cancer survivors face by coordinating physical, emotional, social, and practical care within a unified framework. Evidence shows that comprehensive approaches informed by distress screening enhance access to timely supportive services, improve symptom management, and reduce psychosocial burdens. These models often incorporate interdisciplinary teams, counselors, dietitians, nurse navigators, palliative care specialists, financial navigators, rehabilitation therapists, and wellness providers to ensure alignment of care across domains. Now, flexibility is critical. Organizations must tailor their workflows to available resources, staffing patterns, and patient populations. Survivorship programs that adopt NCCN distress thermometer protocols to their specific context are more likely to provide effective, responsive care. Benefits include improved treatment adherence, greater patient satisfaction, enhanced emotional resilience, and strengthened caregiver support systems. By prioritizing communication, regular assessment of needs, and easy connection to specialized services, integrated survivorship models help survivors transition from active treatment into long-term wellness. They promote independence, empower self-management, and facilitate reintegration into the work, family, and community life. Ultimately, these models reflect best practices in survivorship care, ensuring individuals not only survive cancer, but learn to live well. If our facility does not have a supportive service that somebody is looking to, then we can refer out into community. And all this is documented into the chart. All right, next I'll let Rachel read about some of our supportive services and how they enhance survivorship.
All right, thank you, Terri. So, like Terri and Dr. Ellis were saying, I'm a physical therapist by background. I'm actually taking the place today of Toro's nurse navigator, but we'll be all right. I get to just talk about my colleagues. All right, so first up, we have clinical and emotional support services. So these are foundational roles in establishing and fostering the well-being of patients throughout the entire cancer care continuum. For instance, our oncology counselors provide specialized psychological care to address issues such as anxiety, depression, trauma, coping difficulties that we so often see our patients go through during and after treatment. Psychological services align with the NCCN guidelines for not only timely intervention, but also to just help patients mitigate these feelings and to promote emotional resilience. We heard earlier a wonderful talk about our palliative care colleagues and that they provide a wealth of services, not only for just end of life, but as well as to mitigate and manage symptoms, discuss goals of care, and helping to navigate the truly difficult and complex medical decisions that our patients so often face. We also are fortunate to have our oncology dietitians who provide targeted and individualized nutritional guidance and can also help with symptoms that we often see, such as weight fluctuations, nausea, vomiting, GI distress, and fatigue, while trying to optimize long-term health outcomes. So as we can begin to see, just from this one slide, these services help to create a clinically robust and supportive environment for these patients' individualized needs and to address them holistically. Like I said, I'm taking the place this morning for our wonderful nurse navigator, but nurse navigation and survivorship coordination really work hand in hand in my experience and from what I observed between Terri and Danielle. So there are two services that are essential for reducing the uncertainty, enhancing the communication, and ensuring smooth transitions throughout the different phases of care. Nurse navigators serve as consistent points of contact for patients, helping patients understand treatment plans, scheduling and attending appointments, and accessing the appropriate supportive services when needed. Their role really helps to reduce the uncertainty that these patients face and often provides reassurance during really vulnerable times in their life. In addition, the survivorship care coordinator often extends the support by developing individualized survivorship care plans that address maybe late and long-term issues that patients may face. They can help coordinate and keep track of follow-up schedules, provide lifestyle recommendations, and set some wellness goals for patients to kind of think about their needs as they emerge over their lifetime, and to arrange referrals as needed, both internal and external, as Terri was mentioning. Together, these navigational roles help to overcome lots of barriers of care and really empower patients to promote continuity and to keep up with their treatment to foster wellness. All right. We also have practical and financial challenges as being one of the biggest causes of distress and what patients will so often note on their distress thermometers that come through. So, and these are really significant because while they might not be medical issues per se, they can really hinder access to care and things that we want patients to accomplish. The financial navigators play a vital role in mitigating these burdens. They can help patients understand their insurance coverages, explore financial assistance programs, enroll in grants, figure out appeal denials, and manage out-of-pocket expenses. By addressing this, though, again, frequently noted on the NCCN distress thermometer, they help to support treatment adherence and reduce the risk of financial toxicity, which can last a long time even after the treatment and therapy ends. Practical support services also may include things like coordinating transportation, employment guidance, and connecting patients to other community resources to help supplement what they might need throughout their treatment journey. And again, the financial and the practical services help to ensure that these essential non-medical needs are recognized and are addressed proactively. Okay, this is more my speed. We're also fortunate to have a well-rounded rehabilitation clinic that includes physical, occupational, and speech therapy. So rehabilitation and wellness are critical elements of a comprehensive care model because they can not only address the physical needs, but also emotional and functional challenges that often persist after treatment and after therapy. Rehabilitation specialists address and assess issues such as fatigue, neuropathy, lymphedema, pain, and reduced mobility, and helping these patients regain their strength, their independence, and just their daily functioning. These often work with complementary wellness programs, such as our yoga class, our support groups, and educational wellness talks. These I feel like they're so important because they provide opportunities for connection and enhancing emotional well-being and to, find like-minded people to talk about their stress in a safe environment. We also encourage and are sometimes successful in convincing patients to take up with gym memberships or structured exercise programs, even long after they're discharged or graduate from therapy, just to help to maintain their health journey and encourage sustainable lifestyle habits for cardiovascular fitness, bone health, mental clarity, all the things that we encourage in the different disciplines. But these interventions not only help to alleviate the physical symptoms, but and really empower and promote self-efficacy for these patients, which is key and so important for successful survivorship. So by offering these services, we can help to rebuild confidence and establish a renewed sense of normalcy, helping to transition from just surviving cancer to really thriving and living well beyond it. Okay, and then lastly, we have some prevention, screening, and behavior change initiatives, which are also important for helping to reduce the recurrence risk and promoting overall health. So first up, our smoking cessation programs help survivors eliminate tobacco use, which is a major contributor to poor outcomes and secondary cancers. Dedicated smoking cessation coordinators offer personalized counseling, pharmacotherapy guidance, and motivational strategies to help support the long-term abstinence. Closely related, our lung cancer screening nurses ensure that high-risk individuals undergo appropriate surveillance, enabling early detection and timely intervention. These prevention-oriented services align with evidence showing that effective survivorship addresses consequences of not only the prior treatment, but modifiable risk factors that could influence future health. The behavior change support, integration into distress-informed referral pathways, help patients to adopt healthier lifestyles, improve treatment tolerance, and enhance emotional well-being. So in conclusion, connecting all these services to the distress thermometer that Terri was mentioning help oncology programs strengthen their ability to deliver comprehensive and proactive survivorship care really tailored and individualized to our patients' needs. So with that being said, I'm gonna hand it off to Terri to take us home.
All right, let's finish up here. How does the distress thermometer drive referral integration, holistic support, quality of life enhancement, institutional strengths, and program impact? All right, so when you integrate the NCCN distress thermometer into survivorship care frameworks, it enables oncology teams to make timely, personalized referrals that directly address identified patient needs. A DT score at or above a commonly used threshold that was 4, it serves as a catalyst for intervention, prompting clinicians to examine the problem checklist and connect survivors with the appropriate services. Real-world workflows vary, but successful programs share key features. They clearly define referral criteria. Interdisciplinary collaboration, accessible support services, and mechanisms for follow-up and reassessment. Flexible implementation is essential as studies emphasize that institutions must tailor pathways based on available staffing, clinical settings, and resource capacity. Remember, you can refer outside of your supportive services if your facility doesn't offer it. When integrated effectively, distress-driven referral systems ensure that distress identified during screening leads to meaningful, patient-centered action. This enhances care continuity, supports emotional and physical recovery, and promotes a comprehensive survivorship model that adapts dynamically to evolving patient needs over time. A holistic survivorship framework seeks to improve quality of life by addressing the interconnected dimensions of health that influence a survivor's overall well-being. This includes managing ongoing physical symptoms, supporting emotional stability, enhancing social connectedness, and strengthening functional capacity, and reducing financial or practical burdens. Integrating support services, like the ones we've mentioned, create a multidimensional system capable of meeting diverse survivors' needs. Distress screening acts as the entry point that guides personalized intervention strategies, ensuring survivors receive the right support at the right time. Programs that emphasize holistic care demonstrate improved emotional resilience, better symptom control, and increased patient satisfaction. By fostering independence and empowering healthy behaviors and reinforcing survivor identity, Holistic models help individuals move beyond the challenges of cancer treatment toward meaningful recovery and sustained wellness. Ultimately, this approach supports the overarching goal of survivorship care, enabling individuals to transition confidently from surviving cancer to truly living well. A robust survivorship program leverages institutional strengths by offering a comprehensive suite of supportive services that align with the best practice guidelines and evidence-based recommendations. By integrating supportive services, we create survivorship institutions create an environment that supports patients across all stages of their journey. The impact of this model is reflected in improved patient engagement, enhanced care continuity, and reduction in unmet supportive care needs. Evidence highlights the value of flexible workflows that allow programs to customize distress screening and referrals according to available resources and patient population. Institutional commitment to interdisciplinary collaboration and preventative health further enhances long-term outcomes, contributing to improved resilience, greater satisfaction, and a higher quality of life among survivors. And ultimately, these programmatic strengths position institutions as leaders in survivorship care, demonstrating that comprehensive, integrative support services can help individuals thrive beyond cancer. And in the matter of time, let me just shorten this. Your key takeaways for oncology professionals is make sure you screen frequently for distress using a validated tool. Like I said, we use the NCCN distress thermometer. Anything above 4, you want to make the appropriate referral quickly. And you also want to make sure you're assessing patients throughout their treatment at the beginning, during, anytime you see stress, and during survivorship. Okay, and then oncology teams are encouraged to integrate survivorship-centered thinking into daily practice by consistently employing the distress tool and tailoring the patient's needs and care plans based upon their distress. Okay, that's it.
So I want to wrap this section up to just talk a little bit more about teamwork. The amount of time a cancer patient gets with their oncologist is relatively short across the spectrum of their treatment. And when we're in the room with them, a lot of times it's very problem focused. Sometimes they're uncomfortable talking to us about certain things. And without a team, a lot of things will get missed. And I thought of an anecdote of something that happened yesterday in the clinic where I had a visit with a patient and everything seemed fine. She was like, I'm good. We were setting up an adjuvant therapy plan. And she went home and really kind of started panicking about the medicines. She saw a commercial about one of the drugs and it mentioned the toxicity and she became very distressed. And we got her back in and it really took a team effort. Something that just triggered her that she saw on a commercial about the drug Kisqali, which is a fairly safe drug, but you just never know when something like that's going to happen. And the only way we were able to help her was everybody worked together as a team. And I have the good fortune of playing for one of the best teams in the city. So thank you all very much. So if y'all have any questions for any of our presenters, feel free to. Anyone? Okay.
So the question is how to refer to palliative medicine. Yes, you can put in a referral in Epic for those who are from outside of the system. We do have a method of sending referrals to us. We do see a lot of Ochsner patients. Our outpatient services are limited to University Medical Center for now, but we do see patients from all over the system as well as from Ochsner, and we even get some patients from the Lake that we do telemedicine visits with. We get a lot of Mississippi referrals. Right now, we are expanding into the Mississippi region so that we can start to see patients from Mississippi because it is such a dire need area for palliative.
Doctor, maybe you could ask about how to refer to you.
Yeah, absolutely. Egg cryo, referrals. So we are not on the Epic system. I do have access to Epic. I operate at Baptist, at Toro, at EJ. So I do go into Epic every once in a while, but the most efficient way, so the folks at Children's typically reach out directly to my nurse manager, Wendy Dalferez. I can provide her email, but our website is pretty available, the Fertility Institute of New Orleans. But in fairness, Audubon Fertility, the Fertility Institute of New Orleans, the Fertility Answers in Baton Rouge, we all play very well in the sandbox. Our mission is the same. Let's try and get as many patients through to get them taken care of. So any one of those three entities, we welcome the opportunity to see patients. So I think go the website, but then there is a way that you can refer as a provider directly, and it goes into our scheduler box, and then we call that patient the next day. And then our nursing team will work diligently to get records, and then we'll get the patient in either that day, the next day, or within the week, certainly. Yeah.
And if any questions pop up later, everybody knows how to find me, and I'll be happy to work with you guys. Thank you all so much for presenting, and thank you for attending.